Hi everyone, welcome to Conversations with Student Health Service. My name is Christy and I am here today with Dean, one of the providers up here in the clinic. And today we are going to be discussing sexually transmitted infections and STI testing. Dean, why should college students worry about STIs?
Unfortunately, STIs are fairly common. 1 in 5 people in the United States have an STI. Almost half of all new STIs were among youth aged 15 to 24.
And what STIs should college students be tested for?
Sexually active women under the age of 25 should be screened for chlamydia and gonorrhea yearly, regardless of symptoms. Men who have sex with men should also have screening for chlamydia and gonorrhea yearly. If an individual has multiple partners and uses condoms inconsistently, or not at all, they should be screened more frequently.
How is a test for chlamydia and gonorrhea collected?
For patients with a vagina, a specimen can be self-collected with a vaginal swab or a urine sample. A clinician can also collect a specimen during a pelvic exam. For patients with a penis, a specimen can be self-collected with a urine sample. If indicated, a clinician can also collect throat and rectal swabs. Intersex individuals consult with your provider. Results are sent out and typically return in 1 to 2 business days.
Are there any additional recommended screening tests that students should have?
Yes, the CDC recommends everyone between the ages of 13 and 64 be tested for HIV at least once. Men who have sex with men should be screened yearly or more often as indicated. This test involves a finger poke in which we collect a small sample of blood. Those results are returned rapidly in 15 minutes. Additionally, men who have sex with men should be screened yearly for syphilis. This test involves a blood draw that is sent out and returned in 1 to 2 business days. The cost of this test is $5.
And how can a student schedule an appointment for STI testing?
Students can contact SHS and schedule an appointment to be seen by a nurse or medical provider for STI testing by calling 715-836-5360. Or you can access us on the SHS website by clicking on the My SHS, that's MYSHS, login button to schedule a web-booked appointment.
And is there a cost associated with this appointment?
The visit itself is free of charge, but there may be an additional cost for the actual test or tests. Student Health Service offers chlamydia and gonorrhea testing for $20, HIV testing for $15, and a syphilis testing for $5. If a student is enrolled in the Family Planning Only services, there is no charge for these tests. More information about the program is available on the Student Health Service website.
Are there ways to help prevent STIs?
Yes, STIs can be prevented by knowing your partner or partner's status and getting tested prior to having intercourse. They can also be prevented by using barrier methods during sexual activities. Barrier methods include internal or external condoms for vaginal or anal intercourse, dental dams for oral sex, and finger cots for digital sex.
External condoms are available free of charge at Student Health Service. And there's also condom dispensers that can be found in resident hall laundry rooms. Internal condoms and dental dams are available free of charge at the Office of Health Promotion in Schofield Hall 26. Well, thank you so much for being here with me, Dean, and teaching us more about sexually transmitted infections.
You're welcome. Stay safe and take care.